Namaskar, I am Dr. Sunil speaking on Sambad, and we are entering our venture 3S Dental Care. So let's proceed and we'll show you what is the workflow in our clinic. So this is our brand 3S that represents Shradha smiles. We provide the patient a comfortable ambience. So when the patient enters here itself, they must feel like it is home for them. It's a beautiful busy Kanak road on which our practice is going on, and it's a brand which is 15 years old, and we have an old clinic which is beside our new branch, and this is our new branch. This is our waste disposable system of 3 color code dustbins where we dispose our waste. So let us enter our 3S. This is 3S Sai Shradha Smiles. So let's enter. This is our reception. As long as the patient enters here, as soon as the patient enters here, we try to make the feel patient as if they are present at their home. So this is our comfortable ambience. Patient may have their seat. We have our UV sterilization here. So we always try to maintain the protocols of COVID, and as of now, as of COVID is really going down, but still we are very careful with the COVID protocols. And we have our COVID form which our able receptionists always take care of it. We have every patient's COVID details maintained, whether they are infected or not, or there is common cold or fever, whatever it is, where they have any travel history. We are still maintaining it from past 3 years from where COVID has started. It maintains the safety of all other patients as well as our staffs also. So we maintain all the records of the patient. Even if the patient comes after 10 years, we have all the records of the patient, which our receptionist and the co-receptionist, everything they maintain. So we have divided the work for the reception in different segments. So the patients follow up and patients, any doubt which the patients have, they always take care of it. So we have it at our reception, and we have a pharmacy also. We take care of all the patients' medications needs. The patient doesn't have to go anywhere else, and the patient will get all the medications, whatever they need, at our clinic itself. So this is the basic area of our reception, and we will enter our workspace. We try to maintain some privacy with our workspace. This is the area where all the records are maintained for the photographs, and all the documents are maintained. As long as the patient goes inside, the patient signs here, all the photographs and records, everything is maintained here. Then we have our working area. We have 3 chairs, all working. We have all assistants for every special chair. Every special chair is specially sterilized, and we can have 3 chairs working together. They are Dr. Manaswini, Dr. Bibhu, my assistants. They are specialized in root canal treatment and surgical treatment. She is specialized in cosmetic dentistry, and they take care of my patients as well as anytime, anywhere, or whatever. Whenever the patients have any doubt, they clear everything, and they are my special support. Along with that, these are my dental assistants, dental hygienists, who are well trained in maintaining the asepsis, well trained in maintaining the patient's sterilization protocols, everything. They sterilize all the instruments in a proper way. The workflow is like every patient, when they come, everything is sterilized, and each sterilized instrument is used only once, then we again sterilize. These are our sterilization instruments. This is Biosonic, the latest one. We can work in 3 chairs simultaneously. We have 3 doctors, and we have 2 consultants also, oral surgeon and endodontist. So we have everything in a stable and protocol basis plan, so we can take care of at least 20 to 30 patients in 2 to 3 hours. This is the manpower we have. We can handle 20 to 30 patients in 2 to 3 hours with proper sterilization protocols, and everything we can manage properly. This is our chair of surgical procedures. We take care of the implant surgeries and all. They too are my surgical assistants, well trained, 15 years experience. This is Mr. Prashant. This is Mr. Kumar. He is my technical assistant. He is maintaining all the patient records. Whatever you ask, he will give you immediately. He is very well trained in the IT sector, and he can maintain whatever chair repair or whatever instruments gets immediately damaged, he can repair it immediately. So we have our technicians or our special technicians who can handle every kind of damage or any kind of immediate repair. They can immediately proceed with that. This is our digital X-ray, and this is our basic implant kits. We have several systems of implants. I think 5 systems we have. So we can give the patients various options. Normally every clinic have one system or two systems, but we have 5 systems. Depending on the patient's bone quality and budget and everything, we can give the patients good options. And on spot also we can decide which kind of implant the patient needs. And this is the latest technique to go for root canal treatment. This is the gun with which we can obturate or fill the root canal treatment. And this is the latest one. This is the compactable technique. We have lasers for complete sterilization. We have our digital x-rays, we have OPGs, orthopentagram. We can take a full mouth x-ray with that, so that we can explain the patient the details of their mouth, and with the RVG, that is radiophysiography, digital x-rays, we can explain the patient the local areas of the patient where there is a problem. So we have all the radiographical techniques with which we can with which you can explain the patient what is their problem, and we can take care of it. Then we come to our, this is audiovisual chamber. We have a projector here and we have a boardroom here. We can explain the patient the procedure, whatever they are going on, with videos and all, so that the patient can understand what they are going on or what procedure they will be going on, so that patient doesn't have any doubt. So we'll explain them everything. We'll explain them how it is done, what kind of instruments are used, patient will understand, and everything. This is root canal treatment going on. You can see that how we can explain the patient what is the root canal, where it is. Normally the patient doesn't know about the dental terminologies. We can explain them everything in details, and we can have a board meeting here. We go for courses, we go for hands-on courses, everything, and we train dental surgeons, young dental surgeons also. And this is our special privilege card. We give it to the patients, they get maximum benefit from it. These are 2 color-coded cards. The benefits are there, with separate benefits are there. And these are few brands which we use. This is Zenostar. This is Zenostar for the crown and bridges. This is all ceramic, pure ceramic thing. This is Zircon. Zircon is again a German company. So these are the branded things which we use. We don't go for local brands. So these all things make us completely little bit, we keep our value little bit up compared to others. And this is the boardroom, and this section is our storage room, storage area. So whatever the patients we treat, we keep the records or the 3-dimensional models for at least 1 year, so that even if they come after 7 or 8 months, whatever records we have, we can immediately give it to them. And after 1 year, we keep our cast. We have a separate segment, separate room. We keep there it for 5 to 7 years, so that anytime patient comes for any other treatment also, we have the models ready. So this is the facility. We keep all the complete documentation and records along with photographs, everything we keep ready. We give the patient the maximum benefit with our privilege card. We give the best quality treatment, and we give the best quality result to the patient, and we give the loyalty with these privilege cards also. Even the patient comes for any complaint at any point of time, even if at night or anything, we are always ready with our doctors. Our staffs are always active. Our phone number, our clinic number is always active. So there is no hassle for the patient. We always want the patient to go for hassle-free treatment, along with complete explanation, complete doubt clearance, and we go for everything in a smooth and healthier way, so that the patient will feel that they are present at their home. We doesn't make the patient feel that they are at the hospital or everything. We make the patient comfortable, and we try to give the best to the patient. This is our main motto of CH Dental Care, and we specialize in dental implants and smile designing. Apart from that, we do all the regular procedures. I think smile designing is my main specialization, along with dental implants, full mouth dental implants. Even if the patient doesn't have any single teeth, we can rehabilitate with them with all the teeth. This is the case where the patient was not having a single teeth also, but now we can give the patient with full complete coverage of the crowns. Along with that, we go for Invisalign or the transparent retainers for the malaligned tooth. This is the latest technique in orthodontics. This is the few things which I am showing you in our workflow. We try to make this room as comfortable as the patient can understand properly. We will explain the patient. Time is not a factor. Time is not a factor. We take time and we explain the patient everything. Then this is our consultation chamber. This is our consultation chamber. I always start my day with a bow to sai. Then I This is my few of my achievements. And all this is because of God and everything. This is my chamber where I'll explain the patients all the doubts and I clear everything. So anything you can.
To conclude with, why should a patient visit 3S dental clinic?
I would always say that we don't compromise on quality. We don't compromise on quality because after a 15 years experience, I have realized that if we compromise on quality, the results are definitely going to compromise. So quality and service is our main motto. Whatever the patient's problem is, we will explain them properly, we will explain the procedure and we will not compromise on the quality. That is why, and we have all the latest equipments which are available for smile designing, for implant, for root canal treatment, for crowns and bridges, for orthodontics. Everything we have available with us right now. Patient doesn't have to go anywhere outside Odisha or anywhere outside Mumbai and all, or somebody goes to Delhi and all for the treatment. These all treatments are available with us. We have the high quality lab support with us. We have well trained staffs with us. We follow full sterilization protocol. We have a full workflow system. We give the patient's appointment on time. We deliver our work on time and we follow full asepsis. So this is the reason I think patients can understand that quality is more important than anything, because if you go for good quality, it is having good longevity and they don't have to invest on the dental care again and again, and we do regular follow-up also. If you do regular follow-up, then the patients are more happy with that, they are more satisfied with that, because sometimes the patients, if they doesn't have pain, they will not report to us. So if in between or 6 months or 1 year we'll call them, then they are much happier and they are more satisfied. So loyalty with trust and service. That's why we say we are the friend of your family. 3S Dental Care always serves you with trust and loyalty, and we always are there for your help. For any kind of dental problem, we are always for your help with the best quality and service. Thank you all.